This is Sickle Cell and the Mind, a mental wellness podcast, brought to you by the European Sickle Cell Federation. It's time to reduce social isolation and create new pathways to mental wellness together.
I'm so excited to be here. Thank you for this opportunity. So let's get to it. First question, can you describe some of the challenges that patients with sickle cell disease face when transitioning from pediatric care to adult care?
Patients with sickle cell disease always face a lot of challenges when transitioning from pediatric to adult care. In many cases, the services provided under pediatric care are very individual, they are very caring, they are very personal, that the patient is very connected to the nurses and to the clinicians and to the entire environment of their service. However, when they transition to the adult care, that is different. They become adults and they take charge. They are expected to take charge of their own care. They are expected to make decisions of their treatments, their appointments, and to attend each appointment oftenly as required. Whereas when they're in pediatric services, the responsibility is on the parent to make sure that the child attends that appointment, make sure the child's care is appropriate, it's of good quality, make sure the child takes the medication. And that sudden change normally affects the patient because the patient then is lost without that support from the parent and from the team, the clinician, the nurse, the support worker, the psychologist. They lose that. And once they lose that, they don't know themselves again and they lose track of their management, their self-care, their self attention or disease management for their condition. Those challenges can really be severe for some patients and they can be difficult for them, that they may cause mental health challenges. They may cause giving up, where you find the teenager or the youth giving up on themselves, on their life, because now it becomes more difficult to live life with the condition when that extra care and support is not the same.
So when you think about the healthcare system itself, I'd like to know, how do you think the healthcare system there in Europe supports the transition process for young adults with sickle cell disease? Does that currently exist, and how is that supported?
It's a really good question, and I think that ties into everything that we are working to try and make a change in. At the moment, I would say there is no real universal support, and it's something that we all have to, make an effort to work to improve that support. I don't know if there's a one size fits all system that actually works during the transition process where a young person can go from pediatric care to adult care without having any of those issues that Laura had mentioned. And I think it's about us looking at ways in which we can make a change and try and implement something. We are working on like a transition policy, which could potentially be a blueprint to something that could be used across Europe and also in the UK, where patients will have a protocol that they will follow, and the healthcare system will also be a part of this protocol and integrate it within that transition process, so that when young people go from ped care to adult care, there aren't those gray areas where we have those challenges of mental health, of not understanding our condition, of not understanding what our basic levels are, and therefore feeling like we're just on our own. I think isolation is one of the key things as well. It's very important. And just that lack of understanding of the differences between the two areas. So if we can actually work to improve this, I think it's something that's needed.
Okay. So it's interesting that you mentioned that mental health um, related to transition, kind of the isolation piece. Have you noticed, or do you identify any of the mental health issues that are prevalent during this stage of transition from pediatric to adult care?
I think there are quite a few mental health challenges that patients go through. I might point out maybe two or three. and Jenica could give some
Hmm.
as well. I find that patients during that process, they now have developed relationships with friends or created friendly relationships with their peers. And this is the time that they have to mind themselves and take care of themselves, but they have the fear of informing their friends about their condition. So even when they are sick, they don't want the friends to know that they are sick or what they suffer from. When they have appointments, they don't, and they're going to miss school, they don't want the friends to know. They don't want, even when they're in love relationships with maybe a boyfriend or a girlfriend, they don't want their partners to know about the condition. And they hold it in within themselves and they struggle and suffer continuously. That alone impacts on their own quality of life, but their mental health. It's affecting them because they're going through something major, but they can't share with even the people that are closest to them. So that is a challenge in itself. However, there is also areas of fear that they are not going to be able to have these relationships. They are not going to be able to keep those relationships. They are not going to have a family. They will not get married because nobody wants that. Nobody wants somebody with sickle cell. Those fear as well and the stigma surrounding sickle cell disease affects these patients who are transitioning and are also dealing with puberty, adolescence, and young adulthood. So the challenges are so many. Imagine trying to deal with the changes in your body naturally and also coupled with dealing with the fact that you have sickle cell and what sickle cell brings with it. So the mental health of those patients is really critical, and especially during that transition process.
I
Mhm.
would definitely
Jenica.
agree with what Laura's saying. And I would say, from my own personal experience of going through that transition process, not knowing that what the issues that I had actually were, issues with my mental well-being, because it wasn't something that was ever touched upon or discussed. I wasn't able to speak to anyone. But now, looking back at that experience, I can see that there are so many areas that impacted my mental well-being and my mental health. I think the I always used to have like anxiety and panic attacks around, making sure I was well enough to attend certain events. So Laura touched on, the fact that now you're building these relationships, friendships, or whether that's intimate relationships. And I went through a phase of constantly being sick anytime there was an occasion and always missing out. But what I didn't realize was that, because I was so much, I had so much anxiety in the lead up to these special occasions or events. I was actually, the stress of that was actually putting myself into a crisis. So when we look at some of the issues that come with mental health, like anxiety, those things can actually be triggers for a crisis. So it's kind of like one vicious circle. We can
Mm.
also look at, depending on, the level of how bad someone's sickle cell is. At that point, mine was quite bad. So I was on a lot of medication. The side effects of that medication, me feeling very lethargic, not wanting to do anything, and very down in my dumps, then you can see that there are signs of depression and not wanting to leave the house, not wanting to go anywhere, but then also trying to mask it because you don't want anyone to feel sorry for you, or you don't want to be a burden to your parents. So you'll just say, oh, I'm fine, I'm just, resting or whatever. Just these making excuses, which actually piled on top of each other, become a bigger issue than what is actually easier to see to the eye. So there's a lot of hidden, I would say there's a lot of hidden issues when it comes to mental health during that transition process that people probably underestimate. There can be, if the transition process doesn't go smooth, which in my case it didn't, that first experience that I had in an adult hospital was so traumatizing that the PTSD from that in itself, I never wanted to go back to that place again. And so I would be in a crisis and I'd be in pain and I'd know I'm supposed to go to the hospital. But because I'm so, fixated on this terrible experience that I had, the trauma from that makes me not want to go. And then that impacts my health even more because I'm not going to these appointments or going to get the treatment that I need. So the mental health side of things, I think it's been overlooked for so long on the topic of sickle cell and in the area of the sickle cell disease as a whole. But it's something that definitely should be focused on more, particularly when it comes to the transition stage. It's really important.
So one of the things that you mentioned about your experience, Jenica, with transitioning, the trauma that you actually experienced and things like that. In retrospect, you can kind of look at that and see that there were mental health issues that you were struggling with. You identified some anxiety and depression as it relates to isolation and things of that nature. What role do you feel like um, patient empowerment and education, just about transition and mental health? What role do I guess does empowerment and education play in making a more successful transition process for people living with sickle cell disease?
On the education point, I think it's definitely important to start educating people that live with sickle cell on their condition, because one of the things that I think is very much overlooked is that because we have sickle cell, we know what that means. We know how it affects us and we know all the symptoms that can come from it. And I think if I had a better education and understanding of what sickle cell was, it's not just pain, it's actually to do with, my oxygen levels. I actually have to stay hydrated. I actually shouldn't be in stressful situations, and understanding how each of those things can link to a crisis or some issues that can happen. I think that education is really important, and I don't know if that level of education is actually given to children. I can understand why it wouldn't, but then you go to the adult side of things and it's just assumed that so it's important that we do instill that education at that early age. I think particularly as well for patients to know their numbers. So what's your resting, oxygen rate, what's your normal blood pressure, what's your normal hemoglobin, what's your normal sickle levels, because you can be in any situation and perhaps outside of your normal environment or your normal health team, and those things can spark issues if you're in an area where they don't know that you have sickle cell and suddenly your hemoglobin is so low they think it's an emergency, but that might actually be your base level. So there's so many elements to the education side of sickle cell which I think is really important. And then you mentioned that kind of community and that support system. It's definitely important that I think people living with sickle cell have someone else that they can speak to or that's been through a similar experience to those, and building that community and fostering that support around them is really, really important. I think building your tribe is a term that I use because everyone's experience will be different, but finding the people that can align with how you want to manage your care and your crisis pain or whatever complications you go through, giving people the opportunity to meet people, connect with people, and build their own tribe of support, I think is really important, because a lot of the times our family may not understand, our friends may not understand, and now we have social media and groups where people can just be supporting each other beyond what you'd even imagine. So those areas are really key, and I think we could invest a lot more into ensuring that patients have that impact.
Okay. Laura, did you have anything to add?
Yes, to add to that, I would look at it in the past, and everything that Jenica said is perfectly correct. To add to that in a different perspective, the education for the patients and should also include the services they are going to, and give them enough time to be aware which hospital or which adult services they are joining, who is their clinician, what's the team like. Let them meet the team at some of the sessions while they are still in the pediatric service. Give them enough time, at least a full year or 2 years, prepping them to prepare them for the transition, and also engage with the community or patient organization that is available to handle that support that the patients might need during the actual transition process. The more information the patient has, the more trust they will build for the new service, and the more they will get connected with the new clinician that they're going to be working with in the adult service, and prepare themselves with the changes that they are going to meet once they transition to the adult service. I think that is very important.
Yeah, I agree. So, along those same lines, Laura, you mentioned kind of those services and getting introduced to the adult providers, kind of patients understanding where they're going, who they will be seeing. Are you aware or do you know of any current collaborative efforts between the pediatric and the adult care centers to move that forward?
I'll be very happy to say that in Ireland, that is what happens. And that's why I'm very vast on this one. We are very lucky that we have only, it's not luck that we have only two services, but we are lucky that we have those two services and they work cohesively together, the pediatric service and the adult service. The consultant, the lead consultant in the pediatric service works very closely with the lead consultant in the adult service. And the entire teams have their meetings. They have a set day every week that they need to educate the patients in the pediatric section. The adult service team comes to the pediatric hospital. They talk to the patients and their families about the transition process, about the services the adult service has, the lack of services. For example, we struggle with blood donation, and a lot of the patients in Ireland are on blood donation. They inform them of all those things. They inform them of the importance of attending their appointments, of adhering to taking their medication. So they work very well cohesively, and they set the dates in advance on when patients are going to now move to the adult service. So by the time the patient moves to the adult service, they very much know how they are going to deal with their clinician, the clinical nurse specialist. They know what supports are available. And one other part that they play that is so good, once the patients have moved to the adult service, they invite us as a patient organization to using some of our adult patients to come and give sessions on how they manage their condition while in the adult service. So our members will go and give that session and they will talk about it, whether the patient is on hydroxyurea or blood transfusion. They'll share their experiences and they'll share how the service has worked for them, how long they've been part of the service. And that is very helpful for the patients. However, we still have those who still fall under the cracks. And that's where we come in as a patient organization, working together with the adult service to catch those who have fallen through the cracks, like missing appointments. They will contact us and tell us this person hasn't been come to the appointment for so time. If that patient is a member of the organization, we have a connection already, a link to that patient. We will just engage and provide support and encourage them to go back and attend the appointment. So that works very well in Ireland.
Oh, that's wonderful. That's exciting to hear. Something you mentioned, Laura, just in your response is that you talked a little bit about kind of what the patients deal with in relation to kind of, well, what you hinted at was kind of some cultural, maybe social factors that may influence transition process, i.e., the blood donations. We know that blood donations generally work best for the same ethnic background. So could either of you speak to how do you feel like those cultural and social factors may influence the transition process for young adults living with sickle cell disease?
Well, on our part here, Ireland was behind in accepting donors of African and Asian origin, or donors that have traveled to those parts of the world that have the malaria pandemic or endemic areas. So it was difficult for many years to donate blood if you're from those areas, or if your heritage is African. However, recently they've improved in that area when they realize that it's really beneficial for sickle cell patients to uh, take blood from, or use blood from these people of African or Asian origin. And also on top of that, the supply for blood is very, very limited now, as the rise in numbers of patients becomes more and more, especially transitioning to the adult service, the more they need more blood donors. And they found that they need now to encourage people of African heritage, Asian heritage, or those with the rare blood types to donate blood. And they've made that more clear, but it's been a challenge. So that is in Ireland, whereby we weren't allowed to donate blood before due to the malaria. However, I'm not sure about the other countries, and we are working on that with our Change the Records campaign, which was started actually by Jenica and her group in the UK. So Jenica might speak more on that.
Yeah.
Sure. Could you share a little bit more about those culture and social factors, Jenica?
Sure, I think it varies, as Laura has said. The experience for those in Ireland, it varies from country to country, but I think the common theme around trying to get more ethnic blood donors or blood donors from Black or minority groups is historically just because of what's been done to those major groups in the past. You've had Henrietta Lacks, you've had the Tuskegee, all of these things which have built that mistrust within certain systems that are in place when it comes to donating blood. So I think it's about overcoming those barriers and also explaining that there is a need for this, despite what people may think. The numbers of people living with sickle cell are rising. It's one of the most common genetic disorders worldwide now. So this is important. And the amount of people that have these issues, whether it's sickle cell or even thalassemia for that matter, or the variation between the two, the numbers of people that are having this blood as a form of treatment is rising because unfortunately there's also a lack of funding and a lack of research that comes with the disease, and as a result of that we only have what 3 or 4 treatments in the UK that have been approved. I think I can say that as of today. But for sickle cell being one of the first discovered genetic diseases and only having that small amount of number, we really need to, instill that education within those communities. And it has to be done on a personal level. I think we have all these, you've got the, is it Red Cross, and you in the UK we have the NHS blood and transplant. They try to do their best, but we don't want to exclude everyone that's already donating and everyone that already is giving. So we have to tailor that kind of that need and that want to the different audiences. And I think we are trying with our campaign to specifically target these ethnicities and tell them that it's important because there are people, brothers and sisters and family members that actually need it and how much they can help. So we're trying. It's something that we hope that we can make a difference on this point, but it's going to be it's challenging, but it's going to be done because that's what we do, right, Laura? At ESCF.
Yeah, exactly.
So I think this is really helpful information, and it really ties into my next question. When you think about your organization in general, share with me a little bit about your main priority areas of focus as it comes to improving lives for patients living with sickle cell who are going through the transition process.
So, one of the major areas is highlighting the mental health challenges that patients go through during the transition process. That is a very, very important area, and it's neglected because, first of all, not many people care about sickle cell. They care a lot about all the other diseases, and they rightfully so, they should. But sickle cell is also important. The patients who suffer from sickle cell are important too. They are humans too, and they need that care. They need that attention. And when they go through mental health challenges, it is like every other person. So, mental health challenges have to be highlighted. So, the mental health podcast that we, as the European Sickle Cell Federation, is holding. It's going to take place between 18 to 24 months. It's highlighting these challenges, and it's going to allow patients to share their experiences, what they go through, in the hope that they will get support. But at the same time, they will educate others who are listening. They will also find that they are not alone. We are here, and they're not the only ones going through it. That way they can find ways of managing those challenges, but again with the support of the entire organization and supports from their countries, nationally. A second part that we are working on is highlighting that sickle cell does not affect just Black people, as everybody believes and as research says. It's not a Black people disease, please. Sickle cell can affect anyone and everyone. It is a genetic condition that is passed on through inheritance, just like cystic fibrosis, just like hemophilia, not hemophilia, just like any other rare disease. Sickle cell is a genetic condition that can affect anyone. And through our campaign, Sickle Cell Has No Color, we have identified a lot of patients, at least a minimum of 50 patients that are actually of Caucasian skin tone and are suffering from sickle cell, which is HBSS, the real severe type of sickle cell. They are going through mental health challenges too because they are not believed. You can imagine. They are not believed when they present to the hospital, the emergency department, or their physician when they say, I'm in crisis. I have sickle cell. They don't believe them. They tell them, oh no, you can't have that. That's for Black people. That is horrible to hear. So, the misconception surrounding the racial structure of sickle cell disease prevalence is wrong, and that's what we are trying to highlight. Those are two of the campaigns we are working on, which we believe through the transition process we can also highlight, because you're going to find as time goes on, you're going to find more patients transitioning from pediatric to adult services that are of Caucasian skin tone, and they're coming to your service and they have sickle cell. And you will be surprised. We don't want you to be surprised. We want you to know that yes, that is expected. White people too can have sickle cell.
Yeah, I've looked at the campaign, and it's really exciting information. I'm happy to see that. And as we kind of move forward, just in terms of, and you mentioned this, Laura, just in terms of the transition piece in Ireland specifically, where the patient organization is actually asked to come out to the adult, I guess, hospital system to kind of talk to the patients and bring in other people living with the disease. Are there other activities that your organization is supporting or does on a regular basis for patients living with sickle cell disease during transition?
Oh, we do have another very good project that we work on. We started last year. It's called the Emergency Self Care Packs Initiative. This initiative actually is about us providing self care packs for patients who are admitted in hospital on an emergency basis because of a crisis or any other related effects of sickle cell disease. We provide this in the pediatric and in the adult services. However, we've done that for the adult services more because these patients are new into this center. And when they've transitioned and they call the ambulance, they just go. They don't pack a bag. They just call an ambulance. They don't remember, I'll need a toothbrush. I'll need a spare pant. I'll need, for the girls, don't remember, I'll need a pad. You never know, I might need a pad. I'll need a charger for my phone. They don't remember any of that. They are in pain and they just need to get to the hospital and be looked after. And once they're in the hospital, they can't leave. At least for a good number of days, they are not able to leave. Sometimes nobody knows that they are in the hospital. They might contact us as an organization and inform us that I'm in hospital, and then we take something for them. But in other cases, nobody even in the family know that they're in hospital. Like we said, they don't want their friends to know. So they've not told their friends either. So they are in hospital admitted with no self-care uh, items. So we pack a bag, put in a small toothbrush, a soft toothbrush, some toothpaste, some wipes, a fleece just for warmth, put in a tracksuit. It's like tracksuits and t-shirts because teenagers when they're in hospital, that dress you put on and your butt is out. Many people don't like that. So if we get them a big shirt whereby we make sure that the wires, all their cannulation and all their pick lines, the nurses are able to access them. We get them short sleeved big shirts or dresses to act as nighties. very little things, and a Vaseline to cream themselves, shower gel, things like that. We pack them in the bag and we go and drop them off to the hospital, and each one gets a bag, those who need it. This is a
Mhm.
project that is very, very important. We are actually so proud, and we appreciate those who have supported us. So we are really appreciative of some of the projects we do, in coupled with the education sessions that we do for patients.
Yeah. Yeah, I like the idea of the care package. That's actually really good. I don't think people necessarily think about that
Yeah.
on a regular basis when there's an emergency. You just kind of respond, right? You're not thinking about what you may need over the next couple of days, and you never know with sickle cell how long that actual hospitalization may last. So that's really good information. Jenica, did you want to share anything?
Just that it is brilliant what what you have kind of in Ireland, this like process that you have, which seems to work. I know some fall through the cracks, but generally speaking, it's everything works. And I think that's what would be amazing if we can find a way to kind of duplicate this, elsewhere in other countries. I think sometimes the issue, I know in the UK, the issue is that patients just constantly move around, and there are not so many. It's not like there's one main hospital and then one, like one children's hospital and then one adult hospital. There's so many different ones. So how do we, we have some that work together collaboratively really well, and then we have others where they just find it impossible to do that transition process with the children's hospital because of time, because of resources, because of the capacity. So it's about how we can make it easier for the rest of Europe, I think, using that as a prime example and being able to, spread that out far and wide. I love the idea of those care packs. I wish I had someone that I could have given me a pack. There's been a number of occasions where that would have come in useful. And also, it's something that we can consider as part of ESCF, how we can use what works in one country and try and build something similar in other countries. And I think if we're able to get all of that support on a much larger scale, that's something that we can implement with all of our different member organizations to be able to do for their communities of people that are living with sickle cell as well. So well done, Laura.
Thank you. Thanks.
Oh, this is wonderful information. So I wanna so that I always like to kind of end conversations kind of on a hopeful note. So I have two questions for you ladies to kind of think about and then respond to. The first is kind of when you think about your organization, what are your aspirations for your organization for ESCF for the future?
Well, for me, I would love to see unity among
Mhm.
all patient organizations in Europe. And if all the organizations that exist in Europe could see that the European Sickle Cell Federation's vision is unity, for us to work together, advocate together for better services, educate the community, the politicians, and those who make decisions in the care of each patient. If we work together, we build this, we have strength, we have unity, we have resilience, we can achieve anything. Fighting together to get treatments to Europe is key, because patients with sickle cell do not have a variety of treatments. We now have only three major treatments that are approved, half approved, like the new treatment that has been approved now in the UK. We need to get that in the whole Europe. But how do we do that? It's by working together in unity, having that one voice and fight for every single patient with sickle cell. And even if you are a patient that is in your adulthood now and you feel that this does not work for you anymore because you are at that stage that you don't care anymore, think about the next generation that is coming up. Those who are being born at this stage, growing up and going through the struggle of no treatments, of clinicians not understanding the disease, of all the challenges that they face mentally, of all the difficulties that they have in socializing with their peers. of all the struggle that we now can change to make it better for the new generation. And it could be your child that will have a child with sickle cell. It may not be, it could be somebody you know. It could be your grandchild that will have your great grandchild with sickle cell. So we all need to work together, not think just about ourselves, but for the future generation. So that's what I would want to say, unity.
Okay. And how about you, Jenica?
So much in agreement with Laura. That was, I think, our theme for World Sickle Cell Day in 2023: power in unity and power in numbers. And that just speaks to exactly what we want and what we kind of foresee for the future. I think for me, I would also just add on that equality as well. I know Laura mentioned it, the fact that there are only such few treatments available for us. But just being able to make patients feel like they are seen, they are heard, no matter where they are. Because I think, there are some places where patients might get all of the new treatments. For example, it might be London, it might be Ireland with their transition policy. And I want that equality to be spread far and wide. And I think ESCF acting as that umbrella organization that connects with all of these different member organizations from all of these different countries across Europe, we have that connection then to see what works in other places, to see what's needed in other places, and actually to implement things that can make that difference and build that equality so that patients are seen and are heard and they do feel like, someone's out there listening. It's really hard as someone living with the condition to see what happens like over the waters. For us here in the UK, we look at America and they have more treatments and they have access to a lot more. And I know every country has their systems and stuff, but we are still human and we do still see that and think, I wish. I myself spend a lot of time in Jamaica, and I know that there are a number of different patients over there that think, if only I could get to America, my sickle cell would be fine. Or if only I could get to the UK, I wouldn't be in pain anymore. Or I wouldn't have all the issues that I have anymore. And just knowing that there are people out there that think that they see this and they think, I just wish I could have that. I want for ESCF to be able to start to implement that across Europe. And then who knows, maybe we'll be able to share what we're doing and that can grow to a global level as well. So equality and, as Laura said, unity, like I think those are, definitely our pillars that we're focusing on with ESCF.
This has been an exciting hour, I think, for me. I really, really appreciate the opportunity to speak with you both about what is going on in ESCF, but also with the issues as it relates to transitioning, mental health struggles that are really, really prevalent during this time. And Laura, you've spoken on that quite a bit. Thank you so much, ladies, for this time and this opportunity that you've allowed Novo Nordisk to learn some more about ESCF, but what you guys are doing in the space in sickle cell disease. Thank you so much.
Thank you, Tonya. Thank you, Novo Nordisk, for supporting our mental health podcast and for holding this session. It's very, very important. Thank you so much.
If you have been affected by any of the topics discussed in this episode, please reach out to the European Sickle Cell Federation so we can signpost you to the relevant support services in your country. Our email address is office@escfederation.eu.